Good afternoon. Today is Tuesday, September 1st. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me again today is Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department. We're now entering our 7th month of the coronavirus pandemic. The unexpected expenses due to COVID response have drained county budgets across the United States. Oswego County is no exception. The county's local response to the pandemic has had a significant fiscal impact on our county budget. We're facing a fiscal challenge unlike anything we faced in the past 17 years. We know that there will be a loss of sales tax, New York State aid, and other revenues that we typically rely on. It's impossible to predict the scope of the loss until we know whether the county will receive reimbursement for our COVID-19 response expenses and whether there will be any federal assistance for local governments. Our department heads are in the process of developing their budgets for 2021. Several years ago, in 2003, when the county faced a deficit, many positions were eliminated across all departments. The size of the county workforce was reduced. Since then, the number of county employees has remained relatively stable. Cutting more positions will be an option, but it is not our best or only option. We will be looking closely at services and programs across the board as we develop the budget over the next few months. Last week, I mentioned the steps the county is taking to keep our residents and visitors safe during the salmon run. We have the good fortune to be one of the premier tributary destinations for salmon fishing in the United States, but this also presents some unique challenges under the public health environment that we find ourselves in now. Since the pandemic began, people's travel choices have changed, and now one of the biggest factors is how safe people feel about the community they're going to be visiting. Thanks in part to a coordinated plan and support from you, the public, Oswego County and Central New York have established a reputation as being relatively safe because we continue to have a low infection rate. Now, especially, is not the time to let our guard down. We must remain vigilant in our efforts to practice appropriate personal protective measures. People will continue to come here, college students, casual visitors, and anglers from places around the world. It is what we had come to expect in the average year, and to some degree, what we will continue to experience. Now, more than ever, we must all do our part if we want to stay safe and maintain our reputation as a safe place to live and visit. In preparation for a spike in visitors, several county agencies, including Emergency Management, Health Department, Tourism, and Law Enforcement, met last week with our partners in the State Department of Environmental Conservation. I assure you that we're working together to manage the influx of anglers and to make the experience safe for residents, business, their employees, and visitors. The hospitality industry has been hit very hard during the pandemic, and it will take our businesses a long time to recover. We need to do everything we can to support our local businesses and to keep the fishing experience safe for everyone. And now I will ask Diane to bring us up to date on the latest COVID testing results.
Thank you, Mr. Chairman. As of last week, the COVID-19 virus has reached every city or town in the county. Our overall infection rate remains low at about 0.8%. Showing we are doing a good job of containing the spread of the virus. When we do get new positive cases, we work closely with the state health department and infected patients to track who may have been exposed to the infected person. I want to thank our community partners for their support and professionalism in responding to COVID. Yesterday, we announced that some employees of Pontiac Nursing Home in Oswego tested positive for COVID. The nursing home is working closely with the county and state health departments and notified patients and families. So far, we have low incidence of COVID in our nursing home facilities. Today, total tests that have been performed are 37,356. We have 308 positive cases. We have 21 active cases, 283 patients have recovered from COVID. We have 4 deaths related to COVID-19. We've received 36,000 820 negative test results back, and we have 64 residents in mandatory quarantine or isolation.
Thank you, Diane. Over the next few weeks, you'll see billboards and ads around the county encouraging people to complete their census form. I'm happy to see that we have improved our response rate in Oswego County and brought it up to 61%, but it still needs to be higher. We have until the end of September, but please don't wait that long. If you haven't completed your census form, please take the time to do it, either using the paper form that was sent to you, doing it online at 2020census.gov, or by calling 844-330-2020. An accurate census count helps determine how much federal funding is distributed to our communities for the next 10 years. It's critical to programs and services like healthcare, emergency services, schools, highway construction and repairs, AmeriCorps, and many more services that we use every day. Thank you as always for your cooperation. We've done a good job managing COVID-19 in Oswego County, but we must continue to work together to mitigate the risk of infection and keep our infection rate low. The only way we can do this is to maintain our protective measures. You are the answer, and you are making a difference.